Everyone, it is 8:43. Welcome back to the program. We have the medical director of the John Stoddard Cancer Center, Dr. Andy Nish, with us. And I like you got the memo about wearing the jackets.
Yeah,
nice.
The
Yeah, looking good.
You got that. Okay, so
Looking good. Looking good.
We are here to talk about something very serious that really needs to be addressed. Why don't you explain why you're here?
I am here to talk about our new program, lung cancer screening. Why we're screening people and who are eligible to be screened.
Okay, so tell us a little bit about the screening process.
The screening process is very simple. Basically, someone has what we call a low-dose CT. So a CT scanner is a donut-shaped device where you lay on the table and literally the scan takes 5 seconds.
Now, is that the one everybody's so afraid of? That you talk about, some people say they're really afraid to go through those?
You know, that's more the MR scanner. Okay. Because it's more like a
You're
tunnel.
in that tube.
Yeah.
Right.
So this is more like a donut.
Okay, that's why I want to clarify. Okay.
Not at all. And the reason that we're beginning this program is there was a large study done, it was published a couple of years ago in New England Journal, where they studied 53,000 people. And they compared CT scanning with chest x-rays. And what they found was with CT scanning, we were able to reduce the mortality, meaning the death rate from lung cancer, by 20%. So that's a big step.
That's huge.
That's
so
a big
is
step.
this instrument able to detect it earlier than prior or other methods?
The whole reason we screen, whether it's lung cancer screening, colon screening for colon cancer, mammograms for breast cancer, is to detect cancer in an earlier stage where it becomes more treatable and we have improved mortality statistics.
So who should be getting this screening done?
Great question. It's not for everybody. So like breast screening
As I say,
with
like
mammography,
mammograms, they want you to wait until a little bit
you're
later.
age 40 or 45, and anybody who's over that age gets screened. This is a very, very specific high-risk population. So the guidelines for lung cancer screening are 55 to 74 years old.
Okay.
You've smoked 30 pack years or more. And let me explain what a pack year means.
Okay.
So if I smoke 1 pack per day for 1 year, that's 1 pack year of smoking.
Okay.
If I smoke 2 packs per day for 1 year, that's 2 pack years of smoking.
Okay.
So if you have a 30 pack year smoking history or more, and the third thing is you have to be a current smoker or have quit within 15 years.
Okay.
So we are only screening a high-risk group for lung cancer. We're not screening anybody.
Why is that?
Because statistically it's been shown that we can improve mortality in that group only.
Is a lung cancer diagnosis a death sentence?
No.
If it's caught early enough?
If it's caught early. So just like any cancer, we stage it from stage 1 to stage 4. Stage 4 means it's spread to other parts of the body beyond the organ of origin.
So let's talk about lung cancer here a
go.
little bit, because we know you have some graphics to explain.
So when we talk, we hear a lot about prostate cancer in men. We certainly hear a lot about breast cancer in women and colon cancer. If we look at this graphic, we can see the number of estimated deaths per year. You can see lung cancer kills more people than prostate, breast, and colon combined.
And what percentage of the population smokes? Do we have any idea?
We do. Back in 1965, about 42% of the population smokes.
Okay.
2014, the statistic was 19.1%. So the number of smokers we've cut in half.
Yeah, I'd say about a half, yeah.
We'd still like to continue to decrease the number
Now, does that
of smokers.
include e-cigarettes?
It does not.
It does not.
That is tobacco-related products, traditional tobacco-related.
No, what are your thoughts, speaking of the e-cigarettes, on those?
E-cigarettes were still addicting people to nicotine. There was just an article in New England Journal about the after effects of burning formaldehyde at high temperatures, which is part of some of the e-cigarette composition, and that the carcinogenic effect, meaning the cancer effect, might be higher than cigarettes themselves. So e-cigarettes are not an answer for substitution for regular tobacco.
So is it the formaldehyde that primarily is the carcinogen, or are there others?
This was only looking at that in that study. There are others as well.
And there's a certain amount of, isn't there a certain amount of radioactivity in cigarettes, or am I misled there?
Not that significant.
Nothing
Not
significant.
Really, no.
There's a lot more things to worry about in there.
Yeah. The bottom line with tobacco-related products, cigarettes, is don't ever start using them. If you want to avoid lung cancer, if you want to minimize your risk of lung cancer, don't smoke.
Now, you said minimize your risk of lung cancer. It is possible, if you've never picked up a cigarette in your life, you can still get lung cancer.
Absolutely. 15% of lung cancers are in never-ever smokers.
15%.
Are those
15.
secondary smoked or just something?
Some of them might be secondary. Again, the literature on secondary smoking is becoming more robust. We haven't said for sure anybody who's exposed to a certain amount of secondhand smoke is at higher risk. Radon, we hear about radon here in Iowa. Radon is certainly a risk factor, and it's a risk factor in a small percentage of people. So we like to have people's homes tested. We're talking about getting schools tested for radon and doing radon mitification to try and get rid of those high levels of radon to, again, decrease the risk of lung cancer.
Are there some traits of lung cancer or some aspects of lung cancer that are inherited? Or is this all environmental?
You know what? There are a very small percentage of lung cancers are under a heritable condition. Very small. Colon cancers, you know, there's hereditary colon cancers, there's hereditary breast cancers. Lung cancer is not very commonly hereditary at all. It's really environmental.
So how are there symptoms? Is there a way that someone would understand or be like, I need to get checked out because I might have
Most
something
common
like this?
symptoms are a chronic cough, coughing up blood. Sometimes we have secondary symptoms where people just feel tired all the time, their appetite becomes poor.
But that kind of goes along with friends that I've known that have smoked a long time. That
It is.
It kind of sounds
it's
similar.
it's a little bit of a difficult diagnosis.
Right.
When do you pull the trigger on doing a CT scan for someone who has symptoms? When do you pull the trigger on further studies? That's sometimes a very difficult task.
Once you have symptoms, is it always too late?
Not always. So that's a great question, because once you have symptoms and once you're diagnosed with a cancer, when you're symptomatic, meaning you're coughing up blood or you're having a chronic cough, 70% of those cancers are stage 3 or 4, which are many times incurable. Now, the difference with screening is this is an asymptomatic population. So this is a population that doesn't have a cough, doesn't cough up blood. This is someone who, like you and I, we don't have any symptoms. When you look at the detection of lung cancer in that group, 70 to 80% are stage 1, which is a curable cancer.
Sure.
Okay, now what if somebody watching here might be a smoker right now? They say, oh, maybe I should get checked, but I don't have any of these symptoms. What's it going to cost me to come in and get checked? Will insurance cover you getting checked?
Obamacare mandates that anything with a grade B recommendation by the U.S. Preventative Task Force is mandated to be covered as far as screening. This falls into it. So your commercial carriers have to cover this as a screening procedure.
Wow.
Medicare, CMS, after much debate, finally decided that they were going to cover the cost of lung cancer screening for those 65 and older. So yes, it's covered by insurance. If you don't have insurance, we charge, I think, $199 to have it done.
So it is affordable.
Yes.
And it could save your life.
It can save
And you
your
said
life.
it's 5 seconds?
Literally, once you lay on the table, the scan takes 5 seconds.
Wow. And it could save your life. Lena, let's say you fit within this descriptors that you gave us of people that should get this test. How can they go about getting one? Do they just go to their doctor? Do they need to go to John Stoddard? What happens?
That's an interesting question. Medicare has designated that if you want to get this test, you have to have what's called shared decision-making with your physician, meaning you have to visit your primary physician, you have to discuss the pros and the cons of lung cancer screening, because there's a downside to any screening test. Right. And once you've discussed that, your physician has to write an order, and that order has to be transmitted to us at the Stoddard Cancer Center for screening.
But it's just a matter of steps to get it there.
It's just a matter of steps.
It's worth the effort. So, and then that'd be the easiest way here. Easy to find out information about this, lung.org, lung.org, American Lung Association, to give you some information on this.
And your big message this morning, doctor?
Never start smoking.
There you go.
The bottom line.
And if you are a smoker, get checked.
Get checked, but again, it's only in that high-risk population. Because that's going to be confusing to people. Oh, I smoked, 20 cigarettes when I was a teenager. You're not a candidate for lung cancer screening. You have to be a chronic, habitual smoker who has smoked 30-pack years and be between the ages of 55 and 74.
Well, thank you for giving us that information this morning.
Yeah, you're welcome.
Well, thank you very much.
My pleasure.
Thank you so much
Thanks
for being
having
here.
me.
We'll be right back. It's